CEN Exam YouTube. Question 1. A patient presents with a fever, headache, and neck stiffness following a recent tick bite. The nurse suspects Lyme disease, Rocky Mountain spotted fever, ehrlichiosis, anaplasmosis. Question 2. A post-cardiac arrest patient remains comatose. The nurse prepares for emergent coronary angiography, therapeutic hypothermia, targeted temperature management, immediate extubation, administration of TPA. Question 3. A patient presents with chest pain, fever, and a friction rub on auscultation. The nurse suspects myocardial infarction, pericarditis, unstable angina, aortic stenosis. Question 4. A patient presents with confusion, nausea, and a fruity breath odor. The nurse suspects diabetic ketoacidosis. The priority is to administer insulin, establish 4-access and begin fluid resuscitation, obtain a serum glucose, administer sodium bicarbonate. Question 5. Which finding is most concerning in a patient with suspected right ventricular infarction? Hypotension, jugular venous distension, clear lung fields, ST elevation in lead 3 greater than lead 2. Question 6. A newborn with meconium-stained amniotic fluid is delivered. The nurse should suction the mouth and nose immediately, dry and stimulate the infant, perform a brief assessment and begin ventilation if needed, intubate and suction the trachea. Question 7. A patient is brought to the ED after being struck by lightning. Which finding is most concerning? Confusion, unequal pupils, tachypnea, hypertension. Question 8. A patient with COPD and a history of carbon dioxide retention is receiving oxygen via nasal cannula at 4 liters per minute. The nurse notices the patient is becoming lethargic. The appropriate action is to increase the oxygen to 6 liters per minute, decrease the oxygen to 2 liters per minute, prepare for intubation, administer naloxone. Question 9. A patient with a history of sickle cell disease presents with severe back and chest pain. The nurse suspects musculoskeletal strain, vaso-occlusive crisis, pulmonary embolism, myocardial infarction. Question 10. The nurse is assessing a patient with a suspected pulmonary embolism. Which finding is most consistent with this diagnosis? Productive cough with green sputum, absent breath sounds on one side, sudden onset pleuritic chest pain and tachycardia, fever and chills. Question 11. A patient presents with descending paralysis and areflexia following a recent viral illness. The nurse suspects Guillain-Barré syndrome, multiple sclerosis, myasthenia gravis, stroke. Question 12. A patient with chest pain has a 12-lead ECG showing a new onset left bundle branch block. The emergency nurse should prepare the patient for a stress test, immediate transfer to a medical surgical floor, coronary angiography, observation for 6 hours. Question 13. An adult patient with acute asthma exacerbation is not improving after 3 rounds of nebulized albuterol and ipratropium. The nurse anticipates oral corticosteroids, intravenous magnesium sulfate, discharge home, chest physiotherapy. Question 14. During a cardiac arrest, the first dose of epinephrine should be given immediately after the first defibrillation attempt, after 2 minutes of CPR, before any defibrillation attempts, only after obtaining an advanced airway. Question 15. A patient with a history of depression arrives after ingesting an unknown quantity of acetaminophen. The nurse anticipates activated charcoal, N-acetylcysteine, sodium bicarbonate, flumazenol. Question 16. A patient presents with severe hypertension, headache, and altered mental status. The nurse recognizes this as hypertensive urgency, hypertensive emergency, hypertensive encephalopathy, benign essential hypertension, subarachnoid hemorrhage. Question 17. A patient presents with altered mental status, fever, and a petechial rash. The nurse suspects viral meningitis, bacterial meningitis, encephalitis, anaphylaxis. Question 18. A patient with a history of seizure disorder is actively seizing for 5 minutes. The nurse's priority is to place a tongue blade in the mouth, restrain the patient, administer 4-lorazepam. Start in 4. Question 19. A 4-year-old presents with a 2-day history of a rash on the neck, chest, and back. The lesions on the neck are crusted, and the chest lesions are tiny vesicles on a pink base. The child has a temperature of 39.1 degrees Celsius. The father asks when the child can return to school. The nurse advises 24 hours after the last fever above 38.3 degrees Celsius. Tomorrow, once all the lesions are crusted. In 2 weeks when all the lesions are crusted. Question 20. A patient with chest trauma is noted to have paradoxical chest wall movement and shortness of breath. The nurse suspects tension pneumothorax, simple pneumothorax, flail chest, cardiac tamponade.